channel. Hope you're having a lovely day wherever you are. It's your girl Boo Boo, and if you are seeing my face for the first time, I'm a student nurse here in Nigeria. So, as you've already seen in the thumbnail, we're about to do a procedure. And please, if you have not subscribed to this channel, what are you waiting for? Just try and subscribe, okay? Tell your friends, you can like, you can share, okay? So without wasting much of your time, let this intro not be too long. Let's delve right into the video. So today's procedure, we are going to be doing we are going to be checking vital signs, and it's a tray requirement. It's a tray procedure. So we have our sphig, that's our sphygmomanometer. Our stethoscope is there. We have our gallipot with methylated spirits. We have another gallipot containing cotton wool swab, and we have our receiver for used swabs. Okay, yeah, that's our receiver for used swab. So, as usual, we are going to be taking consent. We are going to inform the patient of what we are about to do. So today we are going to be using Mr. Jones. I don't know if I've introduced Mr. Jones once to you guys, but yeah, that's Mr. Jones lying down. So I'm going to be exposing the area that I want to check. That's the arm. I'm going to use for the blood pressure to check the vital sign. That's the blood pressure. So I'll raise the clothes here. That's how you raise the clothes. Or if possible, you can remove the patient clothes. Then make sure you expel air from the cuff before putting it evenly around the patient's arm. Expel air so that it won't get inflated with air before you tie it around the patient's arm. Yeah, so don't tie it too firm, don't tie it too loose, just medium. Yeah, just tie it round the patient's arm. And don't forget to give psychological support to always remember to give psychological support during the procedure, any procedure at all. Then I'll get my mercury and place it firm at the cuff so I can see it is already calibrated. Yeah, so I can see it there. Then later I'll make sure that the valve of the inflation tube, that's called the inflation tube, and that I'm tightening is called the valve, okay? So I'll make sure that it's tight before I get the stethoscope. And the stethoscope, I'm going to clean the earpiece, yeah, so that I can be free from any microbes or bacteria. I clean with the methylated spirit, that's why we have the methylated spirit there and the cotton wool swab. I'll first clean with cotton wool swab, wet cotton wool swab, and discard in the receiver. Then I'll use the dry cotton wool to clean it off. Then I'll make sure that the bell of the stethoscope is tight. Okay. Then I'll test it. I'll put it in my ear, and I'll make sure that I can hear the sound. This is how I test it before I place it at my patient's brachial artery. Yeah, that's where the brachial artery is located. Then, like I said before, I'll place the diaphragm of the stethoscope over the brachial artery, and then I will inflate the cuff gradually with air. Then at this point, I will listen and then note the point at which the first beat is heard on the calibration. Yeah, you can see at this point, I'm noticing when the first beat is heard. From your stethoscope, you will hear when the first beats. Yes. Then when you hear the first beat, you gradually release the valve of the bulb. Yeah. You gradually release the valve of the bulb. Then you remove and you record your findings. Yes. Then before that, you have to clean the earpiece of the stethoscope with wet and dry, then discard. Then remove the cuff from the patient's hand. Yeah, when you remove the cuff from the patient's hand, don't forget to make patient comfortable. Yeah, remove the cuff. Then you place patients in a comfortable position. Make the patient comfortable. Yeah, make patient comfortable. Then after making your patient comfortable, you go and document. Documenting is the
is a very important part to show that you've already done the procedure. Yeah. So this is me documenting. So you document your findings. Then after documenting your findings, you discard your equipment, okay? You are done with the procedure, you discard. So we're going to be checking for the pulse and respiration together. Then I'm going to be using my index finger and my second finger and place at the radial artery, which is at the wrist. Yeah, you can see where I am putting it in place. So I'm going to feel and count this for 1 minute, okay? Thereafter, for 1 minute, thereafter, when I'm still checking the pulse, even when I'm done checking the pulse, I'll continue counting the respiration because you will not let the patient know that you are checking the respiration because some of them will tend to breathe hard or they will start breathing fast. So you won't let the patient know. As you can see, I'm looking at the patient. I'm done with the pulse. I'm just looking at the patient's chest wall to monitor the respiration. Then later I will chat. Then I'll chat and record the findings, that's pulse and respiration. So for temperature is also a true procedure. Then you need your thermometer. That's my thermometer there. I'll make sure that the bulb is down. See as I'm flinging it so that the bulb will be down. Then I'll get my cotton wool swab and clean it so it can be free from infection or bacteria before I put it in my patient's axilla. So please don't forget, I've already seek consent from my patient. That is why I didn't do it. And then I placed the thermometer at the patient axilla for some minutes and then read it and record. Please don't forget to read at eye level. Yeah, your eye level. You hold the thermometer up and look at it from eye level, okay? So, and lastly, don't forget to document. Thank you. Bye.